Unlocking the power of potassium, a game-changer for heart patients at risk. Imagine discovering a simple, cost-effective solution that significantly improves outcomes for patients with cardiovascular disease, particularly those at high risk for ventricular arrhythmias. Well, the POTCAST trial has done just that, revealing the transformative impact of boosting potassium levels. In Madrid, Spain, the POTCAST trial unveiled its groundbreaking findings, demonstrating that increasing low potassium levels can lead to a 24% reduction in the relative risk of critical events for heart patients. These events include appropriate implantable cardioverter defibrillator, ICD therapy, sustained ventricular arrhythmia, unplanned hospitalization for arrhythmia or heart failure, and all-cause mortality. Dr. Christian Jones from Rig Hospital at Copenhagen University Hospital presented these compelling results at the European Society of Cardiology Congress 2025. The study's senior investigator, Dr. Henning Bundgaard, emphasized that the improvements in outcomes were both statistically and clinically significant. What's more, achieving these benefits involved using familiar, safe, and affordable drugs, namely mineralocorticoid receptor antagonists, MRAs, and potassium supplements. However, the journey to these discoveries wasn't straightforward. Our ancestors enjoyed a diet rich in potassium and low in sodium, which is crucial for optimal cardiac function. Yet today's Western diet, laden with processed foods, disrupts this balance, leading to lower potassium levels. Observational studies have highlighted the correlation between low potassium levels and increased risks of arrhythmias, heart failure, and mortality. POTCAST, an open-label trial conducted across 3 Danish sites, aimed to investigate whether enhancing potassium levels could enhance outcomes in vulnerable patients. The trial recruited 1,200 patients, averaging 62.7 years old, with 19.8% being women. These patients were identified as high risk for ventricular arrhythmias based on their ICD or cardiac resynchronization therapy defibrillator status, and a baseline plasma potassium level of less than or equal to 4.3 millimoles per liter. The majority of participants, 64.6%, had a history of heart failure, while half had ischemic heart disease, and the other half had cardiomyopathies or primary arrhythmia disorders. Patients were randomly assigned to receive potassium uptitration plus standard care or standard care alone. The intervention group received potassium supplementation and/or MRAs, dietary guidance, and, when feasible, reduced use of thiazide and loop diuretics, targeting a potassium level of 4.5 to 5.0 millimoles per liter. After a median follow-up of 39.6 months, patients who received potassium boosts experienced a lower rate of the composite endpoint. The benefits were consistent across various subgroups, including those taking or not taking MRAs and those reaching or not reaching the plasma potassium target. Notably, there were no significant differences in hospitalizations for hyperkalemia, hypokalemia, or kidney failure between the intervention and control groups. Dr. Bundgaard highlighted that the positive effects of high potassium align with previous observational studies and clinical trials involving MRAs in heart failure. He suggested that higher dietary potassium intake might not only benefit heart disease patients, but potentially everyone, advocating for a reduction in sodium and an increase in potassium in our diets. Dr. Peter Weiss from Banner University Medical Center Phoenix praised the study for seeking simple, everyday solutions to complex clinical challenges. However, he cautioned against implementing the potassium uptitration strategy without proper support systems, emphasizing the importance of medication management, supplement administration, patient compliance, and regular laboratory monitoring. The POTCAST trial opens up new possibilities for managing heart patients at risk, particularly those with advanced heart failure. With careful implementation and close collaboration between physicians and patients, this approach could indeed be an easy win in improving cardiac health.